colleagues. My name is Cornelia Betsch. I'm a professor of health communication in Erfurt, Germany. I'm a psychologist, and I apologize for not being with you today. I'm shrinking my picture a little bit so you can see my slides. Thank you for inviting me to present some insights about the psychological COVID-19 situation in Germany. We're collecting data since March and look at the psychological situation every week or every other week. And based on this tool that we developed, WHO developed a recommendation, a new tool to monitor the psychological COVID situation. And I know that some of you have also used this tool, so I'm really interested to hear what insights you reached with this tool. I will tell you a little bit about the German situation. I will basically look at the topic of masks, because this turned out to be one of the most important protective mechanisms. I will give it some insights into how big is the appetite for the new vaccine, should there be one. We're currently in a new lockdown, and we're looking at how people understand the premises of this lockdown, and we look at something that has been made responsible for a lot of cases, which is get-togethers in private settings, parties. How do people behave in this respect? So first of all, if we look at the masks, we can see that mask wearing is actually something that took up speed here with the mandate. In April, at the end of April, mask wearing became mandatory, and the number of people who were telling us that they're wearing masks increased steeply. So the mandate actually worked very well. And what we also saw is that mask wearing was not related to less other protective behavior, which is one of the things that have been discussed at the very beginning. But what we saw is that who was wearing a mask showed also more other protective behaviors, such as hand washing or keeping the physical distance. So in Germany, I think wearing masks has been successfully introduced as a mandatory policy and is still related to other protective behaviors. What about the vaccine? While there was still quite some high intention to get the vaccine, should there be one, in April, it constantly declined. Currently we have like 53, I think it's at the moment, percent who say they want to get the vaccine, and this is of course not enough to build herd immunity, even if the vaccine is a very effective one. So I think there are some challenges on the horizon, and that we shouldn't be so sure that everyone wants to get vaccinated once the vaccine is available. People care especially at the moment about the safety of the potential vaccine, and this is an issue that should be addressed in transparent communication. So one of the reasons for the lockdown that we're currently facing are these simulations. They were published in a statement by our Academy of Sciences, and it contains graphs showing, or simulations showing, that only a very strict reduction by 75% of our contacts can effectively reduce the number of cases. And the later we do it, the longer we need to stay away from each other. And so this was the reason why it was decided to make a drastic reduction of social interaction by implementing a new lockdown, a partial lockdown, and by doing it very rapidly. So what we looked at is whether people understood this mechanism. And what we found is that only nearly 80% agreed that a drastic reduction of contacts would help contain the pandemic. And even though it had been stressed a couple of weeks before, only 73% claimed to actually have reduced their contacts. So the knowledge was not very spread, and people said they were actually not reducing their contacts enough. So the understanding of this mechanism was quite bad, which of course leads also to a less than optimal acceptance of this kind of partial lockdown. Private get-togethers and parties were identified as one of the drivers of the pandemic. And what we see is that the amount of people who say they stopped going to parties or attending parties actually decreased over the summer. People started partying more. And while it was very broadly discussed in the media, people said, okay, let's stop partying. We understand that this is a dangerous thing, but still, even very shortly before the actual lockdown, a quarter of the people still went to parties and put some fire to the pandemic spread. So why are celebrations so bad? Well, because the transmission happens at parties the same way it happens everywhere else. Just because we like the people we're together with, it doesn't mean that they are not harming us or they cannot transmit the virus. That's a very important mechanism, because what we found in a little experiment that we included in the survey is that when you feel very close to people, like you go to a party where you know everyone, so you feel very close, or you go to a party where you don't know anyone, just strangers attend, you feel a lot more distant. And when people feel close to the other guests, they don't feel so much disgust if they don't wear a mask or if they are not showing hygienic behavior. And so they are not wearing a mask or they're distancing less. And ironically, they feel a lower risk of getting infected from the party guests. So that's a very important relation, because it shows that when people attend get-togethers in a private setting, they feel less risk and they don't protect themselves. And this is, at least in Germany, a very important source of infection. Currently, we're facing a partial lockdown where schools remain open, but restaurants are closed, and lots of our private life has been restricted. What we see here in the red line is the acceptance of liberty rights and restricting the acceptance of restricting liberty rights. And what we see is that over time, this acceptance decreased over summer. It increased slightly when our cases rose, but then nothing happened, no political decisions were made, and acceptance declined again. So what we see here at the moment is that we're facing a partial lockdown, and so we're very interested to see how this acceptance will proceed here. What is not very well accepted is the preventive closure of schools, which is the light red line here. So people really want to have schools open, and I think this will be also a very interesting case in seeing whether people agree to this when we see more cases in schools. One of the consequences of the situation is high perceived psychological strain. It was high when the pandemic was had its first peak. Then it was a little bit lower over the summer, and then since October we see that the psychological strain, the burden people perceive, increased steeply. And what we see is that this happens especially with young people. So they were harmed, or they felt the highest burden already in spring, and they feel higher burden, higher than all the others. Also now, as we're facing, this was even before the partial lockdown, so as the cases rise, as we see that the situation becomes more critical. So to summarize, what do we learn from the data? Well, first, the reasons why these measures that are actually taken at the moment, so fast and very strict lockdown, are not very well understood. And so I think it should be communicated why it is important to act early, or why it is important to reduce personal social contacts. And especially, it needs to be communicated that we can get infected by our friends. And this is actually the most dangerous situation when we get together with people who we are close with. So I think health communication needs to be improved here, and probably participatory approaches can help with risk groups. We identified men or young people who are not adhering to the rules so much. So it might be a good task to develop risk management strategies with these groups. Finally, it is very important to develop suitable support and psychological counseling offers, and to provide them at a very low threshold so people can accept support, don't feel stigmatized, and get the help that they need. I thank you for your attention, for your invitation, and if you have any questions, please feel free to contact me directly. Thank you. Have a good day.